Good evening, participants. I am Charlene Rogers, Vice President of Bahama Health. The Board of Directors, Executive Management, and staff of Family Guardian are so pleased that you've joined us for our Doc Talk with Dr. Conville Brown, Chairman and CEO of the Bahamas Heart Center. Dr. Brown will be formally introduced by Dr. Forrestal Dossett, our Senior Manager of Clinical Care and Client Services. Our host for the Zoom session is Mrs. Natasha Lightborn Dillett. Our moderators are Ms. Irene Pintad and Mrs. Tanya Sturrup, who will facilitate your questions at the appointed time. Without further delay, we invite Dr. Dossett to introduce our speaker.
Good afternoon, Ms. Rogers. Good afternoon, Mr. Brown, Dr. Brown. My apologies. And thank you very much. I am pleased to have the privilege of introducing our guest, Dr. Conville Brown. I I had the opportunity to read through Dr. Brown's bio, and this is actually the brief bio, but it's very impressive, very extensive, and I was very like I said, impressed by all of the accolades and achievements that Dr. Brown has had. So I'll try to start at the beginning. Dr. Brown was born in Nassau, just like most of us, and that's where, for me, I think it splits off. But he was born in 1958 in Nassau to parents from the Bluff Eleuthera and Long Island. And then he graduated from Government High back in 1975. Furthers his education in Canada at Acadia University in Dalhousie. When he went to Jamaica, he received his Bachelor's of Medicine and Bachelor's of Surgery degree, MBBS, at UWI. And then he went to do residency and fellowship training in New Jersey at the University of Medicine and Dentistry of New Jersey and Newark Beth Israel Medical Center. He was the youngest qualified internist and cardiologist in the Bahamas and in the Caribbean. He received certification in November of 1991 from the American Board of Internal Medicine in the subspecialty of cardiovascular disease. In March 1994, he was the first Bahamian to be inducted as a fellow of the American College of Cardiology and the third from the Caribbean. He's been involved in developing many medical enterprises, including, but not limited to, the Bahamas Interventional Cardiology Center and Doctors Hospital, the Sunrise Medical Center Hospital Complex in Freeport, the Medical Pavilion in the Bahamas, Medical Pavilion Bahamas, which serves as home to the heart, chest, cancer imaging, breast, and dialysis centers. All such enterprises practice Dr. Brown's partnered care model with government, which assures access to all for said services. Dr. Brown is considered a pioneer in the field of cardiology in the Bahamas and the Caribbean with his organization and advancement of the Bahamas Center for Heart Disease, better known as the Bahamas Heart Center. And as founder and director, physician-in-chief of the Bahamas Heart Center, he's catapulted the center to a level of healthcare excellence. He has instituted, introduced, or facilitated by a private or personal investments, a number of firsts in the Bahamas, and in some instances, the Caribbean during his career, including but not limited to color echocardiography, pacemaker system implants, advanced SPECT nuclear cardiology system, telemedicine, open heart surgery by Dr. Dwayne Sands, cardiac catheterization and coronary angiography, angioplasty, stenting, implantable cardiac defibrillators, 16-slice CT scanners, radiation therapy, et cetera, et cetera. Dr. Brown was recognized for his contributions to the Medical Association of the Bahamas in 1999 as a legend in the field of medicine in the Bahamas. And in 2004, Jones Communication Network Civil Society Person of the Year. He's a long-serving member and trustee of the Sir Victor Sassoon Heart Foundation, former president of the Caribbean Cardiac Society and Council, consultant cardiologist at both Princess Margaret and Doctors Hospital. And at the invitation of Prime Minister Baldwin Spencer of Antigua and Barbuda, Dr. Brown has begun construction of the Cancer Center Eastern Caribbean for the Organization of Eastern Caribbean States, which is 9 countries and over 600,000 plus residents. His latest offering, the Institute for Advanced Medical Procedures, will make advanced medical technologies and therapies available to medical tourists in the Bahamas years before availability in the United States. That is huge. That's something that the Bahamas and the Caribbean has been talking about for decades. So that was very impressive as well. And Dr. Brown is married to Dr. Corinne Sinqui Brown, whom I know very well, a pediatric hematologist and oncologist, and they have 3 children: Conville Stephen, or Stephen, Corey Samuel, and Chelsea Samantha. Despite his busy work schedule, he finds time for his God and his beloved Church of Christ the King, which is located in Ridgeland Park West, which he proudly claims he helped to build as a child some 48 years ago, and where he was honored to deliver the Father's Day address in 2010. Dr. Brown continues to live his medical business motto of striving for excellence with a hearty smile while ensuring affordable access for all via partnered care. All I can say is that was a mouthful, but I am definitely glad and privileged that Dr. Brown was able to take the time to meet with us and speak with us today on such an important topic as heart health, especially fitting this month as this is Heart Month. And so without further ado, I will allow Dr. Brown to get started with his wonderful lecture. Thank you.
Thank you very much, Dr. Forrest. But let me start out by saying thank you all very much, Charlene, for the invitation, and Dr. Forrest for that nice introduction. I actually thought you were talking about somebody else for a while there, but thank you very much. And it's always a pleasure to be involved in sharing knowledge, particularly when it relates to heart disease. Not only is that a matter of heart for me, but it's a matter of heart for a lot of people in the Bahamas, as you will come to appreciate for those that may not have already done so. So our topic today is going to be a healthy heart is a happy heart. And I'd like to express my thanks to the sponsors of this pre-Valentine Day talk, Bahama Health and your wellness program. And again, appreciate the opportunity, one, for being asked to share and to be able to do this again during Heart Month. I've done this, for the last 30 or so years, and a little bit before I went off to specialize. And I find it to be one of the most rewarding things that you could do in medicine, and that is to educate your patients, especially those who are prospective patients. And so if you can prevent them from becoming patients via education, that is the least expensive way to good health and the least expensive way to one's well-being. But as we will see, there are many other ways that heart disease can cost us. And so I'd like to also, having acknowledged our sponsors, I'd like to say that a healthy heart is an important thing because it's our biggest killer. One of our biggest killers in the Bahamas, and as you will see elsewhere in the world as well. And so before you fall asleep, if I have to speak a little louder, let me know, because you really would want to pay some attention, because the heart you save may very well be your own. The other thing that I want to point out, and I'm sure Bahama Health agrees, and I'm using a piece of their slide from their advertisement earlier, and that is that, you see, I'm sure they had a different meaning when they had the hands around the heart, but I'm going to put my meaning on it, and that meaning is that your heart health is your business, your responsibility, and you have to take care of your heart. When you get into trouble, sure, the healthcare providers can assist you, but that's really not the way to address this problem, because you really only have one heart, and when that's gone, so will you. So you really want to take matters into your own hands, so to say, get the appropriate consultation, and educate yourself for the benefit not only of yourself, but of your families. So the things that we like to touch bases on, I think it's clearly evident why a healthy heart might be considered a happy heart. We'll touch a bit on the cost of heart disease, which, as you will find, is quite multifaceted. We'll touch a little on different types of heart disease, tell you a little bit about what you need to do to protect your own heart, and how we as physicians or medical professionals will investigate and then manage your heart conditions and hope you don't have any. And of course, at the end of the day, Domica, my public relations lady at the Heart Center, insisted that we should say what's available in the Bahamas. I will encourage you to know your numbers, not just 911. Hopefully, if you know your numbers, you can avoid 911. And of course, it's easy enough to know your coronary calcium score. We'll speak to that in a little bit. And again, let me remind you that the heart you save may be your own. So let's touch a little bit on the healthy heart. And I think, I hope you can see that any heart that's beating and beating well is probably healthy. And that's how you really want to keep it. We're very pleased that for the past 30 plus years, we've had the privilege and the honor of being able to take care of a number of our country people, so to say, in the Bahamas. Now, when we talk about health, everybody thinks health is just, well, I shouldn't say everybody, but it's commonly felt that when we talk about health and a state of wellness, we're really talking about the physical side of things. And if our body is physically intact, then we are otherwise well. Well, I think we all have come to appreciate that health is a state of wellness of many aspects, not just our physical and our mental, but the spiritual, of course, is probably the most important, the health of our spirituality and our soul, and of course, the social side vis-a-vis our family. And God knows, if you ain't got no money in your pocket to put food on the table, then the first three things probably won't mean a lot while your stomach is grumbling. So the financial health and financial wellness of ourselves and our families are also equally important. And our total health then is in totality a state of wellness. I want to reiterate, your health is your concern and therefore your problem. If you feel like you should make it the physician's problem, I think you're barking up the wrong tree. You can get advice from your healthcare partners. You can get advice from your healthcare consultants. You can get treatment prescribed. But at the end of the day, we can't take the tablets for you. We can't do the exercise for you. And I am not going to volunteer to jump into the grave for you. So there are certain things you're going to have to do on your own. And therefore, let's start out by making our health our concern. And you know what's good? Those that are present and those that intended to be present and those that have other things to do are already taking a very important step, which is to educate oneself. Okay, and I think that's one of the most important aspects. So we, not only at Bahama Health and those in the remaining healthcare profession, we can partner with you to help you achieve and hopefully maintain good health. But it's in your hands. Let's not forget that, and that can never be underestimated or underemphasized. So the first thing we need to determine is if we have a problem, because if we don't acknowledge or know if we have a problem, then it's a bit of a challenge to correct it. So it helps to know what we're dealing with. And when it comes to the heart, be it a healthy heart or a diseased heart, we have to appreciate the magnitude of the problem. Heart disease, as we know, is probably, well, I would say, it's one of the causes of morbidity and mortality in the Bahamas, amongst us, in the Caribbean, our neighbors to the north in the United States, and generally in the Western Hemisphere, definitely in industrialized countries. And so the more developed we are, the more we tend to have heart disease as a major cause of morbidity, which is people just not doing well. That's the disability side, because you have not yet arrived at your mortality, which is death. So it's a major cause of disability and mortality. And I hate to say, when you start looking at the leading causes of death, you see where it falls? In first place. That's not one of the things you want to be in first place, but that's where it is. It is the leading cause of death in the world. So when you look at your numbers, some 17 plus million people per year die from heart disease. Approximately 30% of deaths around the world. That number is absolutely frightening. So everybody would assume that last year, the amount of people that would have died from COVID-19, the pandemic of COVID-19, and we'd be all stressed out over, look at the number of people that are dying and so on and so forth. Well, let's keep the numbers. Let's forget the 17 million for a second. And let's just look at the United States, where we know how many 100,000, I think they said is about 400,000 plus now that would have died in the past year or close to a year, since COVID-19 has been with us for, I guess next month we'll make a full year. But more than 400,000 people a year die in the States from heart disease. Okay, so as frightening as COVID-19 is, heart disease outduels COVID-19. That is not good. But it's also a global problem. So while we have several countries where the mortality from COVID-19 is relatively low, heart disease has been there, is still there, and if we keep doing what we've been doing, it will remain there as a major problem. So what about the cost of heart disease? Well, I've already suggested that it's a multifaceted matter. And, you know, months ago, I used to spend a fair amount of time during educational sessions, whether they were on TV or whether they were on radio, media, whatever. And one of the jovial things I would always say is that it's not Dr. Brown who's expensive. It's managing heart disease that is expensive. Some would argue with me and say, yeah, doc, you're expensive too, but not really. It's really heart disease that's very expensive. And heart disease is the most expensive group of illnesses in the world to investigate, and for a lot of reasons. So it's a challenge for an investigation, for coming up with a definitive diagnosis of one's form of cardiovascular illness. And then, of course, then there's the treatment, and we'll have more to say about that in a while. And then supporting the patient with heart disease. These are all very, very expensive. But what makes it even more tremendously expensive at the national and international level is the fact that the sheer overwhelming numbers of people with cardiovascular disease outdoes everything else. So when heart disease can easily account in any country for 25+% of the illnesses that can lead to one's demise or significant disability, that is a frightening number. And you usually need to add up causes numbers 2, 3, and 4 to come close to number 1. That's frightening and devastating. That's probably why when Charlene and company at Bahama Health hear you have heart disease, they won't insure you. They run away from you, but we're not going to talk about that. That's not the purpose of the talk. But that might be some incentive to make sure you don't have heart disease. So the sheer overwhelming numbers, which are growing, makes it not only expensive because the investigation and therapy and so on are expensive, but the high unit cost for each of these items is also very expensive. So you have a tremendous multiplier effect. And of course, with cardiovascular disease, it's technology after technology after technology that is utilized in the management of cardiovascular disease, all of which having a multiplier effect on the overall cost, and therefore the burden to a country can literally be spoken of in terms of the percentage of GDP that goes to the management of cardiovascular disease. Not a good thing. When it comes to our families, does it cost our families? Well, absolutely, because it is one of the most taxing things that you could come up with. We all think about, well, yes, it's expensive, as Bahamians would say, money-wise. And sure it is, but it has a physical and mental cost. It has tremendous costs for our families. And you know, for some of us, that's the only time that we really get spiritual. and pray to the good Lord for our health and our soul is when we think we're either having a heart attack or about to leave in an untimely manner. But suffice it to say that it is a very costly illness to entertain. So not only does it affect a lot of people, but there are many different types of heart disease. And it affects all ages. So whether you are in utero, meaning you're still in the womb, you've not yet been born, we are now able, and have been able for some time, to be able to diagnose heart disease in utero. In fact, I think it was early last year, someone actually performed surgery, heart surgery, on a fetus in utero. Now, that's what you call real innovation and really high tech. Of course, for the neonates, who are the babies who have just been born, infants, children, adolescents, adults, like myself, the elderly, like some of you, and then those that find out the problem. There's a thing I have to get off my screen here. Oh, how do I get rid of this for you? How do I get this label off the screen? This one. How does that come on? Oh, okay, don't worry about it then. Thank you. So the bottom of the slide, which I can't see, I think speaks to finding out that you have heart disease, which can happen at all ages, and it can even happen being discovered in the post-mortem scenario. Now, you really don't want to find out after death that, oh, you had heart disease. It's usually a good idea to find out before so you can do something about it and hopefully not end up with an untimely demise. As for the different types, the heart basically has about 4 major layers to it, 3 in particular for the heart, and then of course the heart leads out to blood vessels, giving off arteries and receiving veins that bring deoxygenated blood devoid of nutrients back to the heart so they can get replenished. The blood can become replenished and then circulated again. So we look at heart disease in general. There's basically 2 big types. There is the congenital, which we would tend to see in babies and in young children that can have various forms of heart disease that they would have been born with. And nowadays, because of the advances in taking care of these kids, they actually have a whole specialty in medicine now called what some people abbreviate as Gucci, for GUCH, and it's for grown up congenital heart disease. But it sounds sexier to say Gucci, the Gucci group. But a lot of kids that ordinarily would have passed at a very young age are now living into adulthood. And so they are presenting a new form of heart disease that we really do not learn about very well while in medical school, believe it or not. So, but that's one category. So that's a congenital, but the majority of the heart disease that we see is acquired. And the fact that it's acquired, I can say right now, means that if you know what's causing it and causing you to acquire the heart disease, then you probably can come up with solutions as to how you can help to prevent the particular problem. So at the level of the endocardium, which is the inner lining of the heart, we can have valvular heart disease, sorry for the typo, valvular heart disease, and should you get an infection on your valve, that's called infective endocarditis, a problem we used to see a lot more many years ago, especially when rheumatic heart disease was rampant, but not so much nowadays, though it's not one of the things that you want to miss because it can have a significant mortality if not recognized and therefore not treated appropriately. The myocardium is the heart muscle. And by the way, all words in medicine and definitely in cardiology, we have these big, long words, but if you break them down into their component pieces, life becomes easy. So endo means on the inside, cardium is heart. So this is the inner lining of the heart. Myo is muscle, cardium, so the muscle of the heart. And peri is around, so this is the layer that surrounds the heart, the pericardium. All right, so that makes life easy, similar as in myocardial infarction would be death of heart muscle, commonly called a heart attack. Another typo. Oh, this is unusual for me. I'm not good on the typos. And then, of course, we can have heart muscle damage by hypertension or high blood pressure. And of course, there's several other things that can cause cardio, heart, myo, muscle, path disease. So heart muscle disease can be due to diabetes, can be due to obesity, where we are a little fluffier than we ought to be. And of course, if we ingest a little too much alcohol, that can also be one of the things that can cause heart muscle disease. And of course, for the pericardium, we talk about pericarditis, and you've heard people talk about, docs say I have fluid around my heart. Others say, docs say I have fluid in my heart. And then they say we have fluid in the lungs. Well, if you don't have any fluid in your heart, you're not alive. But you don't want to have fluid in your lung. And if you have it around your heart, well, there's several things that will cause that. That's called an effusion, and hopefully doesn't lead to any undue morbidity. And of course, disease of the blood vessels probably causes more trouble than all of these other guys potentially put together, particularly coronary artery disease. And so where the big boys, as we all know, would be heart attacks, one of our biggest killers, high blood pressure, and many of the complications associated with it, one of which is strokes, diabetes, obesity, high cholesterol, major problems in our society. One of the things that we are very good at, of course, is assuming that I'm not the guy with the problem. It's really the person next door. So even while we're having our conversation this afternoon, everybody loves to say, you know, the things Dr. Brown is talking about, you know, my mother had a little of that, my father had some, but not me. It's really my next door neighbor. So I'll have a chat with my neighbor when I go home. I've never seen a Bahamian in the Bahamas who readily says, I have diabetes mellitus. Most people only have a touch of sugar. And most Bahamians seem to be, they have the ability to look into the future, and they can tell when their pressure is up, usually by feeling it at the back of their neck. I don't know how well that correlates with the blood pressure machine. But my point is that we really have to make sure we educate ourselves, be honest with ourselves, and admit when we are at risk of this killer, because that's the only way to describe heart disease. It's a killer. And the classical, I suffer from gas, be careful, because we have more people in the graveyard in the Bahamas and in the Caribbean who suffered from gas. And it is not nerve gas, it's not poison gas, it's the sensation that they have dyspepsia or acid reflux, et cetera, et cetera. And some people do, and many people do. The problem is when you confuse that kind of quote unquote gas with actual angina or discomfort in the from the cardiovascular system based on blockages in the blood vessels. That is not a mistake to be made. So we'll talk about that in a little bit. And of course, not taking our medicines because they make me sick. For some men, of course, there's special medicines that make them sick, and so you know they ain't taking them. Well, we have quite a few of those that are already at the level of postmortem. The best one I've had really is an elderly lady. I was giving a talk on one of the family islands, and she says, you know, Dr. Brown, my doctor at the clinic tell me I have pressure and I have sugar. But I tell him, I ain't claiming that. So I said, Mom, do me a favor, while you're not claiming it, please take the medicines. And when the good Lord tell you, you truly ain't got the problem, you can stop taking the medicines. I really don't think she took me on. Because when they tell you they ain't claiming it, you can imagine they're not. So now, let's have a news flash. We've had, what now? I think we're on our 4th prime minister in the country. And several years ago, one of our prime ministers, there was a news flash that the prime minister was diagnosed with cancer, one of our catastrophic illnesses. And of course, these people shall remain nameless for reasons of confidentiality, if that can in fact exist with a prime minister. News flash number 2. There was another prime minister who was on the brink of a heart attack. And my colleagues and I were fortunate enough to be called to take care of said prime minister. And I think we did a pretty good job because the prime minister is still around today. And third news flash is that another one of our prime ministers, and we ain't had that many, so I'll leave it up to you guys. Assume you're reading the punch and figure it out. Another prime minister actually suffered a stroke. These are all serious catastrophic illnesses that can result in one's demise. The real story at the end of the day is that whether you're talking about heart attacks, strokes, or cancer, it can affect us all. And you don't even have to be a prime minister. So again, be careful. So when we look at more specifically at the kind of heart disease that we need to be concerned about or that we see a lot, the major one really is atherosclerosis, or hardening, blocking of the blood vessels that supply the heart with blood. And of course, that can then lead to symptoms like angina, which means chest discomfort that's due to the heart vessel and the plumbing not allowing adequate blood flow to the heart muscle. This is like in your house, if you've been in a house for the past 40 years, and God help you if you have cast iron pipes, then they tend to become somewhat blocked as well over the years. And you'll find that you're probably not going to be able to take a good shower on the first floor. You may need to shower downstairs, and then you may have to resort to just taking a bath because you just can't get adequate blood flow. So even your shower gets starved of water, as does the heart, if these vessels get blocked. And so we've already mentioned that this is the biggest killer in the Bahamas and North America. And you know, once ago, it used to be considered that women really did not have heart disease, that they really only caused heart disease. No, let's not go there. But that women did not have heart disease. And it has come to be known in the last 15, 20 years that women actually have as much, if not more, heart disease than men. The worst part is that for many years, women would go to the emergency room, and women tend to go to the doctor faster than the men in the first place. But the women would probably present to the emergency room and say, listen, you know, I'm having some chest comfort, it really doesn't feel good, and so on and so forth. And many of them would be grossly underdiagnosed, grossly undertreated, and of course, the morbidity and mortality resulting from these medical errors were really nothing to frown at. So thank God, in recent times, you've heard about what's it called, the Woman in Red, I think, campaign that by the American Heart Association that actually promoted awareness of heart disease in women, so that we could be more cognizant of it and therefore be better at recognizing it. Men, however, do tend to suffer heart disease, coronary disease in particular, at an earlier age than do women. But by the time they get into the 50s, they catch us up real fast. Not good, but it is what it is. And so if we won't go through all of this, we'll simply point out that if your vessel is nice and clean, then, well, actually I should take this one here, a vessel that is nice and clean, the lumen or the channel is not impacted by cholesterol molecules, and so you should have good flow. So that's your typical house that's less than 5 years old. You're not using cast iron pipes, they're using PVC, and so the plumbing is nice and clean. But later on, one can start accumulating atherosclerotic plaque or cholesterol molecules that then tend to adversely impact the blood vessel, and you can actually cause total obstruction of the vessel. If that happens, we can pretty much end up with heart attacks if it's a vessel to the heart. You can end up with a stroke if it's the vessel to the brain. You can end up with loss of limb and amputations if it's the vessels going to the feet or the upper extremities. And so it starts out as a little plaque, and at this point we won't have any symptoms. But by the time the vessel becomes much more occluded and blocked with cholesterol deposits, the channel gets significantly narrowed. And of course, if you were to form a clot, and this is why there's a recommendation to take aspirin so that your platelets, the little fellas that tend to cause your blood to clot, you try to literally disable them somewhat so that the chances of clotting off and forming a clot in your blood vessel and causing a heart attack is diminished. Otherwise, this is what happens here. And then that vessel that supplies that area of the heart muscle, well, if you can't supply blood to it, then that heart muscle is at risk not only of starving and causing chest discomfort if you're lucky, because if you're not lucky, and you would say, why would you want to have pain? Well, if you're not having any discomfort from the heart muscle starving, then you really may not know that you have a problem. And you stay home. And listen, heart attacks will kill you whether it caused pain or not. So if it's a silent heart attack because it didn't cause any discomfort, if it's a missed heart attack because you thought it was gas, doesn't matter. It still runs a very high risk of killing the individual. And as a number we used to remember a long time ago, if 4 people have a heart attack at 12 midday, by the time you hit 2 o'clock, one of them is on the floor dead. So if he sits down and thinks that, oh, I should have the hot peppermint tea and the Maalox and my Lanta and all of the different things and all of the other home remedies, rather than getting to that emergency room and seeking to have that vessel opened so that you can get better blood flow to the muscle, then you run a 25% risk of dying within 2 hours. That's frightening. How do we get heart disease? Well, we can have things that can increase our chances of developing heart disease and other illnesses for that matter. We call those risk factors. And they can be major if they're very powerful or minor if they're not so powerful. And some can be modifiable and others not. So for example, your parents. Well, some of us would love to modify who our parents are, but that's not usually a choice that we give. So we don't get to choose our parents. And but one of the things for sure is that the more risk factors you have, the greater the chance you have of blocking your vessels. We spoke about not being able to change your parents, but what's of interest, of course, is one's family history, because a lot of the aspects of cardiovascular disease have a genetic element to them. Smoking is something that you need not do. You need not hang out even with people who smoke a lot and get a lot of secondary smoke, because that still has its challenges. Cholesterol, well, that's one of the bases of blocking your vessels. And of course, I put in red diabetes mellitus. And why? Because in spite of smoking and the high cholesterol and the high blood pressure and advanced age, male sex more so than female sex in the earlier ages, the presence of diabetes mellitus alone for an extended period of time is one of the most potent risk factors for the development of heart disease, and in particular, coronary artery disease. Let me repeat that. The presence of diabetes mellitus for people 10 years and more, especially poorly managed, poorly controlled, because we only have a touch of sugar. And so I don't really need to take the medicines, because if I eat right, that solves the problem. That is a recipe for disaster. So I need you to understand that diabetes mellitus is one of the worst things you can have, but you can also do something about it. 80% of diabetics will die a cardiac death. That tells you how bad and how potent diabetes is in heart disease. 80%. So out of 100 people with diabetes, 80 of the 100 will die a cardiac death. Not good. And so long-standing diabetics are actually considered and ought to be considered to have heart disease if you don't give them anything else. Because if you have an 80% chance of dying from heart disease, there's a better than 50-50 chance that you have heart disease as a long-standing diabetic. And so the term that is used is that long-standing diabetes is described as a cardiac equivalent. That's frightening. But take it under advisement, do your research, do your homework, and if you are in fact diabetic, and even so, if you only have a touch of sugar, pay attention to it so that touch doesn't become full-blown diabetes. Inactivity, physical inactivity, and of course, obesity. In the Bahamas, we don't really recognize obesity. We say, I got on a little bit too much weight. I had one patient told me she was fluffy. The other one told me she was pleasantly plump. But we didn't really acknowledge being overweight. Well, here's another news flash. The Bahamas is in the top 10 countries in the world for obesity and overweight prevalence. Top 10 in the world. that is not good. We only got 400,000 people, for crying out loud. We got 70, the number was, I think, 71, 72%, and this was about 5 years ago. And I had to do the research because I was involved in a clinical trial for an obesity drug, and really didn't realize how useful it would have been in the Bahamas until during the research we came up. I think at the time it was like number 2 or 3, but I think we may have dropped it a little bit down and somebody else may have overtaken us. But that's a pretty frightening number. So definitely a problem to deal with. And when it comes to stress, we've all heard about people having broken hearts. Well, they're not all to do with Valentine's Day. There is actually an entity called a medical broken heart. So for those of you that like to Google things, Google broken heart syndrome, and you will find that a lot of people during stressful times can actually develop a syndrome very similar to a heart attack and can be involved with dysfunction of the heart. And a lot of the people, it comes back to normal, and in some it doesn't. So you can actually have a true entity called a broken heart. So it's not all about the fellow having left. And when it comes to weight loss, there are several benefits for people losing weight. The way Bahamians like to do it, of course, is we call on we call it the fairy godmother, and then you have to make a wish. And of course, as she says here, okay, we can do that, but each pound is going to cause you a separate wish. And you probably only got 4 wishes. So the benefits of weight loss would include reducing your risk for cardiovascular disease, your blood pressure is easier to control, your sugar comes down and is easier to control, and as do your lipid levels, especially for your bad cholesterol. So I must say, however, that not all cholesterol is bad. So your HDL cholesterol is like the policeman, your LDL cholesterol is like the criminals. And the crime, of course, is blocking your vessels. So just like if you have a society where you may have very few criminals, but you don't have any police, you can still have crime. And so if we have little bad cholesterol, but no good cholesterol that keeps our vessels clean, then we still run the risk of blocking our vessels. I had to find out the hard way that I actually have a low HDL. Part of it was stress. I must be involved with stressful activities. I don't know. And but my HDL plummeted all the way down to close to in the 20s. And so while I'm counseling patients at the Bahamas Heart Center and telling them about the things they need to do for their heart and make sure they don't get this and make sure they don't get that, I actually ended up with an elevated calcium score, suggesting the presence of coronary artery disease. Needless to say, that was quite frightening and sobering. And the only risk factor that was identified was a low HDL, which was not always low. So apparently that can move in the wrong direction. And so be careful and be aware. We won't talk about high blood pressure right now, even though it's a very prevalent problem. You can do something about it. And it's typically called the silent killer, because by the time it causes pain, it's much too late for you. We spoke about diabetes already. And so this is where you want to be on the spectrum for your blood vessels. You want them nice and clean, nice clean pipes and tubes. You don't need them blocked. You sure don't need them rupturing the plaque and causing a clot to form, because that's exactly how we get heart attacks and strokes and loss of limbs. What do we have to do to protect our heart? Well, if you know all the bad boys that can create a problem, then you should try to do what you can to control those. But one of the first things you have to do is educate yourself. So you need to understand or be aware of the signs and symptoms of heart disease that should make you seek help if it were to develop. Corey, just answer that for me. To seek help if it were to develop, and of course, try not to ignore them if you have certain symptoms, because ignoring the symptoms doesn't necessarily make them go away. You may go away. And so chest pain, and I always say, I don't like when doctors ask patients about chest pain. We really ought to ask about chest discomfort, because it may not hurt, but it may be very uncomfortable. So chest tightness, heaviness, pressure, squeezing. Most people won't call those pain. And so, yes, you can ask about pain, but don't forget to ask about chest discomfort. And of course, shortness of breath. There can be many reasons for it. Heart disease is one of them. Easy fatigability, palpitations where you can feel your heart beating, especially when you don't expect it to. Orthopnea, you can't lie flat without feeling like you're drowning. in your own secretions, swelling of your legs, nausea and vomiting, sweating when you ought not to. And I'm not talking about women when they're going through the change. I'm talking about you sitting down, it's cold, you're in an air-conditioned space, and you're still sweating like crazy. Then one needs to be concerned. And when we talk about gas, as we indicated before, lots of people in the graveyard, but look at the company that the gas is keeping. So if you walk upstairs and you develop the sensation of gas, that's a problem, because gas should not be on exertion. If you lift something heavy and you get gas, that's a problem. Okay? And of course, once you have any symptoms, treatment delayed is equivalent to treatment denied. And they say time is money. Well, time in heart disease is muscle. And the more muscle you lose, the greater your chances of death and or heart failure. So you want to recognize the symptoms. You want to call who you need to call. 911. It's not always a good idea to jump in the car and drive yourself. We've had a number of catastrophes happen accordingly. And hopefully a sensible ambulance will come and collect you, get you to the emergency department, and they can do what's necessary to try to get your vessel open, or at a minimum, first make the correct diagnosis. How do we investigate and manage heart problems? There are things that your physician will do. Everything starts out with a history and a physical exam. And if it doesn't, change your doctor. We also do a chest x-ray to look at your heart size, because the only time a big heart is of benefit to anyone is at Valentine's Day. So by the time we hit February 15th, let the big heart stop on February 15th. So the 14th for Valentine's Day, not a problem. But a big heart is a weak and failing heart. So you really don't want your heart to be enlarged other than for emotional reasons or sentimental reasons, but otherwise, and so the chest x-ray can help us in that regard. The electrocardiogram can tell us about the electrical activity of the heart, and there are several patterns that could suggest that the heart is affected by things like high blood pressure or by blockages causing starvation, or even show evidence of a heart attack, as can your echocardiogram, which is like an ultrasound of the heart that can show you. In fact, this is one of the most informative tests that we can perform on your heart, because it can tell us how well the muscle is functioning, if the heart is enlarged, if the valves are leaking, is it likely that you have blockages because of how the muscle is moving or not moving for that matter. And of course, the exercise stress test is used to determine if you can induce symptoms that may not be happening at rest, and that can give an idea of the cause. Holter monitoring, looking for abnormal rhythms, and the coronary calcium score is very important. If your vessel is clean and without blockages, your coronary calcium score should be 0. Why? Because calcium attaches or can attach to the cholesterol particles in your blood vessel wall. So if there is no cholesterol particles in the blood vessel wall, you don't have coronary artery disease. Good for you. Your score should be 0. Anything higher than 0 means that you're on the wrong path. And the higher it is, the worse it is, and the greater your risk of a heart attack. And then, of course, we have catheterization, where we pass tubes through the groin, through the wrist, into the blood arteries, and up into the heart. And we can take pictures inside the heart. We can do measurements of blood flow. We can take pictures of the blood vessels, called angiography, and determine if there are blockages that we need to be concerned about. So when we talk about managing heart disease, this is where it gets very scary. The least expensive thing, the cheapest, the free, and most effective means of managing heart disease and preventing it is in your lifestyle, changing it and adjusting it so that you promote wellness as opposed to disease progression. And that's essentially free. Now, after that, it starts to cost you some serious money. So if you happen to be diagnosed with heart disease and you're on medical treatment, I just call it close money. You may spend a couple $100 a month. You may spend a couple of $1,000s per year. Let's just call that close money. If you need to go to the cath lab because you're having a heart attack and you need an angiogram and angioplasty and a stent to keep the vessel open, and God help you if you need the medication we call a clot buster to open up the blood vessels, then you could be running into car money. Now, this really not the Mercedes-Benz car. That's closer to when you need cardiac surgery. But you could be talking easily $15 to $25, $30,000 for interventional management of heart disease, depending on the nature of the heart disease. There are some that can approach $100,000, and that is closer to house money. So, but if you need open heart surgery, you can easily end up with a bill of $40,000, $50,000, $100,000, $250,000, depending. That's house money. Irrespective of the neighborhood you're in, that could still be house money. So these are things you really want to avoid as much as possible. For palliation, that usually means that's where they make the sign of the cross and they say to you, well, you know, there isn't anything else that we can do. And that's palliative care, or what I call too late money. So don't wait till then to spend your money. And of course, at that point, we just aim to try and keep you comfortable. You'll think you're talking about the cancer patient. What's available in the Bahamas? Well, at the Heart Center and several other centers in the country, we all have consultative cardiology. That's the consultant taking the history and the physical, sharing their expertise. Non-invasive is the performance of tests that don't require cutting your skin. Invasive testing, obviously, as we just suggested, involves putting catheters and tubes into you and doing various measurements. Interventional services, as are being performed in this cartoon here, this picture here, is where we can open the vessels with a balloon and a stent. Cardiac surgery we've spoken about already. And of course, it could be surgery of the vessels, both in the chest and elsewhere. At the Medical Pavilion, we also have probably the only hybrid suite, or one of the few hybrid suites in the entire Caribbean. And that's where we're able to not only do angiography and interventional procedures, but also anesthesia requiring procedures and surgery at the same time. So that's in our specialist center at the Medical Pavilion. You should know your numbers, and we're getting close to the end. You should know your numbers. So what numbers you ought to be concerned about? Well, as we mentioned risk factors, we mentioned things that can cause heart disease. And so for good health, and for good heart health in particular, you want to be able to acknowledge your height and your ideal body weight. Now, there's a simple formula that I'll give you, and it doesn't apply in most of the Bahamas. So for women, you take your height, and for every inch above 5 feet, and this assumes, of course, that most of us are taller than 5 feet. So for every inch above 5 feet, you add a pound. You start with 100, and you add 5 pounds for every inch above 5 feet. For men, it's 106 and add 6 pounds for every inch above 5 feet. And if you're significantly off from that by more than 5 to 10% in total, then you're probably too short for your weight, or as most people would say, you're overweight. And you're in that 70% of our Bahamas that's overweight or obese. And that has its own ill effects. You should have your blood pressure should be 120 on the top and 80 on the bottom or lower. And so when it comes to blood pressure, Bahamians talk about, oh, I have low blood. Listen, there's no such thing. The lower your pressure, the better, until it's too low. If it's too low, it means that you can't sit up, stand up, or walk around without getting dizzy. That's when it's too low. It's too high when it exceeds 130 and 90. Then it's too high. So over a period of time, you will get more and more of the complications related to high blood pressure. The higher you are above the 120 over 80, the greater your risk of developing those complications. So yes, you want your pressure to be on the low side, not the high side, but you don't want it on the too low side. For heart rates, you'd like your heart rate to be 70 at the highest when you're relaxing and not doing anything, and preferably lower than 70. I'm sorry, as you walk around, climb the stairs, we expect your heart rate to increase. That's normal, and then it should come back down. For your sugar, you'd like your fasting to be less than 110. For your cholesterol, you want your total to be less than 200. For men, you want your HDL. Unlike myself, you want your HDL to be 40 or more. Mine was less than 40. In women, you want for more protection in women, you want their HDL to be 50 or higher. And of course, if you have heart disease, then you want your LDL to be way, way down to less than 70. And then there's a protective effect as well as a restorative effect insofar as you can actually stabilize your vessels and help to remove cholesterol deposits from them. Triglycerides, we won't spend a lot of time on. That's the fat in your blood, less than 150. And you want, when you work out your risk by the blood test, you take your total cholesterol and divide it by your HDL, and you'd like that number to be between 3.5 to 4.5 at best. And if it's lower, that's even better. If it's higher than 4.5, you have a tendency to block your vessels. If it's less than 3.5, you have a tendency to clean them out. If you're a man and your PSA is less than 4, that's usually a good thing. And you want your calcium score, as I mentioned, to be less than 10. Important numbers, 911, if you have symptoms that impress you or frighten you. I think this is 356-6666. Well, that's the number to the heart center. Easy number to remember, but you should also know your own doctor's number. But no 911 so you can get to the hospital. And your calcium score, we've already indicated, should be less than 10 and preferably 0. So this is the CT scanner, multi-detector CT scanner that is used to perform your calcium score. So it doesn't require you to get stuck with anything, no contrast injection, and then we're able to determine what your calcium score is, look at the blood vessels, and we can see their outline and see if there are calcium deposits in them. And that will tell us that, yes, there's cholesterol deposits in the vessel, not a good thing once you correlate it with your symptoms. And of course, we can also electronically remove the muscle so we can look at that which we're interested in, which is the blood vessels, and sometimes be able to see blockages. And so in closing, I want to say that you want to remember, do not wait until it is too late to build a strong and healthy heart. The choice is yours. This matter is in your hands. And so for a happy, healthy heart, educate yourself. Don't smoke. Don't start if you don't. Lose weight towards your ideal. Eat less animal fat and cholesterol. Control your blood pressure, your sugar, and your stress levels. Exercise regularly. Follow your good doctor's advice. And remember that prevention is better than cure. And don't forget that heart disease is truly a family affair. Education leads to knowledge, and self-effort and support. In other words, the things you do can lead to good health. Sorry, and we always have to close like the good old Bahamian, that we shall overcome, and we can overcome all things through Christ who gives us the strength and the victory over all things on earth, including heart disease. And so I would like to wish you all pleasant and persistent heartbeats. Thank you for your attention. Thank you for having me, and God bless.